Good afternoon, everyone. Welcome to LUMP TCM and Acupuncture webinar. Let's start the ball rolling with our first presentation. Let's welcome Ma'am Neat from Cavite, certified acupuncturist. Good afternoon, Ma'am Neats.
Good afternoon, Doc Hector. Good afternoon, everyone. So, topic for today is about blood, day 13. Okay. Heat in the blood. Yung clinical manifestations ay feeling of heat, skin diseases with red eruptions, thirst, bleeding, yung tongue mapula at yung pulse ay rapid. Okay? If heart blood has heat, mayroong anxiety, mental restlessness, and may mouth ulcers. Okay? If liver blood has heat, mayroong skin diseases characterized by itching, heat, and redness. Okay? Let's go to heat in the blood, more explanation. If blood heat affects the uterus and penetrating vessel, there is excessive blood loss during the periods. Okay? If there is blood heat in intestines, there is blood in stools. Okay? So this is the diagram. Yan yung blood heat. It is the feeling of heat, skin diseases with red eruptions. There's thirst, bleeding, and red tongue, and rapid pulse. Okay? Kapag sa heart, there is anxiety, insomnia, mental restlessness, mouth ulcers. Kapag sa liver, itching with red papules, irritability. Kapag pumasok sa uterus, there is menorrhagia. And if it is in the intestines, there is blood in stools. Okay? That is feeling of heat, skin diseases with red eruptions. Unulot lang po natin. Thirst, bleeding, red tongue, rapid pulse. Okay? Heart blood heat, there is anxiety. Yung kanina binasa na natin. Ulitin ko lang po. Anxiety, mental restlessness, and mouth ulcers. Sa liver blood heat, skin diseases characterized by itching, heat, and redness. Blood heat in the uterus, there is excessive blood loss during the periods. And blood heat in the intestines, there is blood in the stools. Okay? So, make note. Clinical note, the points liver 2 and spleen 10 can cool blood. So, yung gagamitin. Another combination is liver 3 with kidney 2. Andyan po yung illustration kung paano kung saan siya nakalagay. Opo. So, liver 2, nakakagamot siya. Symptoms po yung there is stress, irritable, and anger. Yan po yung gagamitin natin point. Insomnia, yan, bladder infection, heavy menses, dizziness, and temporal headache. Yan po, liver 2 ang makakagaling. Okay? Point, liver 2. So, yun po yung location ng spleen 10, tune upper border of the patella and medial border of the patella. Ito po. So, yung spleen 10, ano po yung uses? For bladder infection, for inflammation, for rashes, eczema, for hives, and menses issues. Okay? Yan po yung location ng liver 3. Liver 3, yung pong uses ng liver 3, for high blood pressure, swollen and red eyes, for PMS, tender breast, moody and bloated, for urinary and genitalia issues, for depression, for dizziness and vertigo, and for temporal headache. Okay? Yan. Kidney 2. Let's go to kidney 2. Andiyan po yung location sa may paa. Okay? Kidney 2 is for nocturnal seminal emission, for coughing of blood, for irregular menstruation, for genital itching, diarrhea, and uterus prolapse. Use kidney 2. Okay? Thank you very much.
Thank you very much, Ma'am Neats. Up next is pathogenic factors. Let's welcome, straight from Legazpi, Sir Dino Pinheiro. Good afternoon, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Okay, we go to the climatic pathogenic factors, part 4. Okay, sa dump, this factor mostly affect the organs of the earth element, which is the spleen and stomach. Sa first tower diagram, we have the spleen and stomach are in the center, and spleen circulates body fluid to the periphery. An excessive dampness would cause fullness, heaviness, nausea in the middle, edema and stiffness in the hands and feet, heavy-headed dizziness, and headache like a band or helmet. Yung treatment is to sedate yin. The second tower diagram, the yang increases as a reaction to the yin excess. The symptoms are that of heat, may vomiting, reflux, gastritis, pancreatitis, lymphadenitis, foul breath. Sa treatment, we could sedate the yin. Sa third tower diagram, with prolonged exposure to dampness, the function of spleen and stomach is inhibited. As a result, the emptying time of the stomach is prolonged. Insulin secretion by the spleen pancreas will decrease. The peripheral circulation of blood will decrease, and there will be poor peripheral sensitivity and wound healing. Sa treatment is to sedate yin and tonify qi. Sa last tower diagram, same symptoms as in the left, but more chronic with severe functional deficiency of the digestive system. So ang treatment is to tonify qi. Dampness could affect any organ system. Damp symptoms are stagnating and dirty may cause heat. Dampness could be the basis for a chronic inflammation. It is very important to understand these words of wisdom, stagnating and dirty. Sabi ng author, my interpretation is that it means that it accumulates and becomes thick and stagnant is a breeding ground for infections and create heat symptoms. One example of this is varicose veins. In this case, there is edema, which may cause eczema, or an ulcer which will last forever. Another example is acne vulgaris, which manifests as pustules. Both these are example of for the fact that there is less function of vessels in the first case and of skin in the second. The blood or fluid cannot flow or disperse freely, and the stagnant fluid becomes the base for heat and inflammation to set in. So sa first tower diagram, poor function of circulation causes stagnation of thick fluid. And the second tower diagram, heat and inflammation produced by the damp stagnation of thick fluid. Dampness can manifest in any organ system. Excessive raw food, milk products, refined sweets, and carbohydrates can cause internal dampness in the spleen. Sa treatment, localized dampness, we use stomach 40 to circulate. Generalized dampness, we use stomach 40 and spleen 9 to eliminate damp. Local treatment is to use cupping and moxibustion selectively. Damp examples, we have dampness in the lungs, cough, asthmatic breathing, worse in wet weather, excessive white foam mucus, thick oily skin, melancholy, black nose, low sense of smell, lung edema. So sa treatment, we use lung 5, sedation, UB13, LI4, stomach 40 for damp. Next, we have dampness in the liver, short or long sightedness, premenstrual tension, depression, distension below ribs, belching, nausea, heaviness in vertex, heaviness and dampness in external genitalia area, hydroxyly, fungal infections of perineum. Sa treatment, UB18, LI4, liver 14, GB37, UB18, stomach 40 for damp. Thank you po for your attention.
Thank you very much, Sir Dino. We now proceed to yin and yang relationships. And for this afternoon, we shall talk about interconsumption. This is actually a continuation of the examples that we gave for interconsumption. So let's go to example 4, in which the yin consumes the yang. Firstly, if you have cold or damp exposure over a period of time, the yin increases initially. And obviously, or automatically, the yang will go up. So the yang rises, and when the yang rises, this will cause symptoms of inflammation or fever. And this is now called, this would be the pathogenic yang. Thirdly, the functional qi or the good yang is consumed, no? Because tuloy-tuloy po ang presence, no? And eventually the yang will be fatigued. So it's basically the functional qi being affected. So the cold and damp exposure consumes the warmth, and this will inhibit the functional qi or the yang. Then, so we have a pathogenic heat, the harmful heat, which will cause the inflammation, and we have the good functional or yang qi. So in the case of inflammation, the pathogenic heat remains high. This is the slowing of functional yang or qi deficiency caused by long-term cold or damp exposure. So this is a very simple illustration of how prolonged exposure to cold or damp can lead to weakening of the functional qi. So treatment, of course, we need to tonify the qi or the functional yang by using the bakshu and the luo connecting points. And then we have to sedate the yin or reduce the yin. If the heat or inflammatory symptoms do not disappear, we can add bloodletting or electrostimulation locally to either eliminate or disperse the heat. Example 5 for yin consuming the yang is the presence or exposure to exposure to cold. We all know that cold will increase the kidney yin. So eventually the yang will increase, causing the fever. There will be arthritis, backache, ear infection, pyelonephritis, or cystitis. There is a definite history of exposure to cold, and the patient continues to feel very cold even with the fever. So lalo na pag medyo maedad na, wag na masyadong too much exposure sa cold. Or probably if you have to migrate somewhere else. So the functional qi goes down while the pathogenic yang is still present. So the inflammation is actually the yang pain, the fever, and this is reducing the functional qi. Okay. So what are the symptoms of qi deficiency? Stiff joints, poor block flexibility, loss of hearing, water retention, or incontinence. A continued state of inflammation. So pag hindi na-relieve yung inflammation, because you're not able to get rid of the cold, so this will inhibit the functional qi, the normal functional qi. It is always the healthy yin and yang that are consumed, not the pathogenic energy. So treatment, we will use bakshu point of the kidney, which is bladder 23, to activate the function. We also use bladder 58, which is the luo connecting point of the urinary bladder. Patients should be advised to keep warm, although no moxa should be used. Bleeding cup to eliminate pathogenic heat, and we can also do electrostimulation or electroacupuncture to disperse the heat in local areas only if necessary. Thank you very much for listening. Up next is the 5 elements. We'll listen once again to Sir Dino Pinheiro for his discussion on the fire element. Good afternoon ulit, Sir Dino.
Good afternoon, Doc. Good afternoon po sa lahat. Now we go to the fire element part 4. Associated color, which is red. The heart circulates blood and heat to the body, especially to the thorax, face, and arms. Hence, a red face or a pale one would attribute to an imbalance of heart. The facial color is a good indication of the blood and circulation function of the heart. Sa face color, red face, meaning there is heart yang increase, blood is increased, also the liver yang is increased. Pag pale face, the blood is decreased, yang is decreased, and also the liver blood is decreased. Lang yin or yang deficiency. Pale face with red cheeks, ibig sabihin blood or yin decrease, yang increase in the heart or lungs. Pag purple face, there is blood stagnation with chi decrease. Because red is the color highlighted by the heart, it is also the color that can bring energy to the heart. When we ask the patient to say if they strongly like or dislike an environmental color, this would also give us a clue as to whether there is an excess or deficiency of energy in any organ system. Sa like and dislikes, like bright red, ibig sabihin there is yang decrease. Pag ang patient naman likes pink or lilac, ibig sabihin there is a decrease in chi. Pag likes deep red or purple, ibig sabihin there is yin or blood deficiency. Pag dislikes bright red, ibig sabihin there is yang increase. If there is dislike deep red or purple, ibig sabihin there is yin increase. Sa associated flavor, bitter, as in coffee, cocoa, Campari, chicory, bitter gourd, grapefruit, red cabbage, and over-toasted or roasted food. When a person has fever, they would have a bitter taste in the mouth. This shows that they have excessive heat in the body. But there is a craving for bitter foods when there is a yang deficiency in the heart. We consume coffee to keep our minds active, and those who need many cups of coffee or very strong coffee are people who need more bitter flavor in order to stimulate their mental activity. Heart yang and chi. But others would suffer from tachycardia or have problems going to sleep after 1 cup of coffee as the bitter increase their heart yang. Sweet bitter flavor, such as coffee with milk and sugar or bitter chocolate, increases heart yin. Craving for bitter flavor indicates heart yang deficiency. Craving for sweet bitter flavor indicates heart yin deficiency. Associated emotion, we have joy. Joy is the inner light within us, our contentment with life, whereas laughter is the expression of joy. When a person talks and laughs very much, he or her heart yang is high. When one is never content or their laughter is empty of joy, then there is a heart yin deficiency. Excessive joy and laughter, ibig sabihin there is heart yin and yang increase. Less joy but lot of laughter, there is yin decrease and yang increase. Less joy and laughter, ibig sabihin there is yin decrease, yang decrease, blood and qi decrease. Content, but does not lack much, ibig sabihin yang and qi deficiency. Tao teaches us very early in life that nothing is permanent, that everything is undergoing a continuous change. For example, say you wake up one morning to clear blue skies, have enough time for a good breakfast that hopefully someone else made for you. Get to work and your first two patients are very well after your treatment and sing your praises. How would you feel? Happy and content. There's energy that comes to our heart from food, love, sleep, sun, mental stimulation and praise, and encouragement. It is sufficient for filling the heart. If things are going wrong at work, there are problems between staff, and the atmosphere is not good, if the split is affected and the weather is cold and gray, it is difficult to keep our inner light burning. But if day-to-day life situation and weather can give or drain our heart energy, then it is also possible to increase it with acupuncture. If we can tonify, increase the energy level in the heart, this will also improve the mood of the patient, and all our depressed patient would feel better. Thank you po for listening.
Yeah, thank you very much for that very enlightening presentation, Sir Dino. Marami sigurong nakaka-relate. Ewan ko lang. Okay, so yun. We would like to continue with the essence. We are now on day 4 for Jing or essence. Let's talk about post-heaven essence. This is a complex of essences refined and extracted from food. And this is collectively known as post-natal essence or post-heaven essence. Because stomach and spleen are responsible for digestion of food and transformation and transportation of food essences, ultimately leading to qi production, post-heaven essence is closely related to stomach and spleen. It is not a specific type of essence, but simply it's a general term to indicate essences produced by stomach and spleen after birth, as opposed to pre-heaven essence that is formed before birth. For this reason, stomach and spleen are known as root of post-heaven essence. Kidneys are known as root of pre-heaven essence. Let's talk about kidney essence. This is a more specific kind of vital substance which plays an extremely important role in human physiology. Kidney essence derives from both pre-heaven and post-heaven essences. Like pre-heaven essence, the kidney essence is hereditary energy, which determines the person's constitution. Unlike pre-heaven essence, the kidney essence interacts with post-heaven essence and is replenished by the post-heaven essence. The kidney essence partakes of both pre-heaven and post-heaven essences. It is stored in the kidneys, but it also circulates all over the body, particularly in the 8 extraordinary vessels. Kidney essence determines growth, reproduction, development, sexual maturation, conception, pregnancy, menopause, and aging. So let's compare essence and qi, or let's cite the differences between essence and qi. Essence is primarily derived from the parents before birth, whilst qi is formed after birth. Essence is replenished only with difficulty, while qi can easily be replenished on a day-to-day basis. Essence follows very long cycles of 7 or 8 years. Qi follows briefer cycles, some yearly, some circadian, some even shorter. Qi moves and changes quickly from moment to moment, whereas the essence changes only slowly and gradually over long periods of time. Functions of essence: growth, reproduction, and development. It is the basis of kidney chi, producer of marrow, the basis of constitutional strength, and the essence is the basis for the three treasures, the Jing, Qi, and Shen. Thank you very much, everyone, for listening. We now continue with Zangfu organs. Let's listen once again to Ma'am Nits Yu, certified acupuncturist from Silang, Cavite. Good afternoon ulit, Ma'am Nits.
Good afternoon po ulit, Doc Hector. So the topic for today is about the spleen pattern, spleen chi sinking, okay? It is a sub-pattern of spleen yang deficiency. Spleen's function to hold organs in place is impaired. Yan, kaya nagkakaroon ng spleen chi sinking. Cardinal symptoms of the spleen chi deficiency and spleen yang deficiency. Additional symptoms, organ prolapse, katulad ng uterus, bladder, rectum, and stomach. Pushing downward feeling, yan, may hemorrhoids and varicose veins, okay? Another one, spleen not controlling blood. It is a sub-pattern of spleen yang deficiency. Spleen's function to hold blood in vessel is impaired, so bleeding occurs. Bleeding can also be caused by heat in the blood, okay? Cardinal symptoms, purpura, blood in stool, blood in urine, melena, menorrhagia, uterine bleeding, all symptoms only in combination with symptoms of spleen chi deficiency or spleen yang deficiency. So remember, okay, symptoms. Another one is spleen not controlling blood. Ayun yung purpura, blood in stool, blood in urine, melena, ala ko melana, pangalan, menorrhagia, uterine bleeding. That is the bleeding disorders originate because spleen is not able to hold blood in vessels, okay? Another topic, another pattern, damp cold in the spleen, okay? It is the further development and complication of spleen yang deficiency. Spleen yang is unable to transform food and dampness is produced, okay? Dampness impairs the movement of qi. This can manifest in a feeling of constriction. Qi is unable to rise to head and feeling of heaviness manifest in the head, okay? Clinical damp cold in the spleen, cardinal symptoms of spleen qi deficiency and spleen yang deficiency. Additional symptoms, loss of taste, feeling of heaviness in the head, mabigat, feeling of heaviness in extremities, mabigat yung mga katawan, yung extremities, weariness, edema, crust around the eyes, vaginal discharge, and cloudy urine. Okay. Another pattern, damp heat in the spleen. Okay. Ito yung further development and complication of yin deficiency. Yin deficiency leads to heat. It causes the spirit to be restless. In order to compensate for restlessness, patient may or should eat dampness producing foods. And damp heat in spleen is the result. Yung pala, kaya siya nagkakaroon noon. Okay? Pagkain ng mararaming cause. So, cardinal symptoms, feeling of heaviness, soft, strong smelling stool or constipation, abdominal pain, thirst without desire to drink, thick yellow tongue coating, feeling of belt around body, meron pala nun, ano? Duodenal ulcer, ventricular ulcer, feeling of heaviness in the head, helmet-like headaches. So, pag meron kayo niyan, damp heat in the spleen. Thank you for your attention, everyone.
Thank you very much, Ma'am Nits. That was indeed very helpful. Let us now continue with our discussion. This time we listen to Sir Dino once again for meridian theory. Good afternoon, Sir Dino, ulit.
Good afternoon, Doc. Good afternoon po ulit sa lahat. Now we go to the stomach channel of Foot Yang Min Part 4. Yang Min stomach channel. The physiological significance of the channel changes. Observation of areas related to Yang Min stomach. Redness or heat on the forehead or around the eyebrows reflects stomach heat. Red nose, not the same as the nostrils in large intestine heat, can indicate an acute accumulation of heat in the stomach. Swelling or sores on the face, as well as some types of acne, can be reflective of heat toxin in the Yang Min. Swollen gums, tooth grinding at night may also indicate Yang Min heat or fire. Pulse palpation of areas related to Yang Min stomach. A noticeable fast pulse at the stomach 8 area indicates rising Yang Min heat. This could be associated with headaches or stomach problems. Palpating the channel, pressing the points, and feeling the body surface. Tenderness or very small nodules found at stomach 44 and stomach 43 indicates constraint, heat, and blockage in the Yang Min. If there is heat trapped in Yang Min, the patient will also often present with thirst, bad breath, and nausea. Severe tenderness between stomach 41 and stomach 42 is often seen with severely painful Yang Min type headache, toothache, high blood pressure, or nausea. This is due to Yang Min heat rushing to the head. Okay. The area between stomach 36 and stomach 39 can be especially informative. Its general quality is helpful for assessing overall digestive function. In addition, cases of Yang Min type, facial pain, or numbness due to accumulation and stagnation in the Yang Min will present with severe tenderness in this area. Bleeding can be curative. Weakness or softness indicates Yang Min deficiency or possibly cold congealing in the channel. This may include chronic gastritis or deficiency type ulcers. A soft nodule in the area around stomach 34 indicates congealed cold in the Yang Min, causing stasis. This is often associated with patterns involving stomach pain or gastritis. Chronic cold stagnation in the channel can also lead to ulcers or growth in the stomach, which might present as hard, tender nodule at stomach 34. Next, we have stomach 25, will show strong pulsing in the cases of excess accumulation in the Yang Min channel or organ. If there is softness or a sense of weakness in the area around stomach 25, this might indicate a deficiency of Yang Min channel Qi. Deficiency type constipation may also manifest as softness in this area, while tightness and tenderness generally indicate excess. Tenderness or nodules at the stomach back associated point bladder 21 indicates chronic stomach problems due to long-term stagnation in the channel. This may include ulcers. So we have here sa area ng stomach 34, pag merong soft nodules, ibig sabihin there is a congealed cold in the stomach, cold type ulcers. Pwede rin hard nodules, ibig sabihin there is cold causing physical changes in stomach organ. Sa area ng stomach 36, stomach 39, if there is severe tenderness, ibig sabihin acute inflammation in the upper Yang Min, mostly sa face. Pag merong softness and weakness, it could mean that there is chronic digestive weakness, qi and yang. Sa area ng stomach 41-42, if there's severe tenderness, ibig sabihin, yang mean excess, type headache, high blood pressure, yang rushing upward. Sa area ng stomach 43, stomach 44, pag may tenderness, ibig sabihin heat in the yang mean channel or organs. Or pag may small nodules, acute heat or qi stagnation affecting yang mean channel or organs. Sa stomach 25, strong pulse, excess in yang mean channel or organs. Pag may tenderness, except type constipation. Pag softness and weakness, ibig sabihin there is deficiency, cold in yang mean organs. Thank you po for your attention.
Thank you very much, Sir Dino. We now come to the last topic. We are still on breathlessness, on the patterns. Lung qi obstructed. Clinical manifestations, sudden attacks of breathlessness precipitated by emotional problems. So bawal magkim-kim ng emotions. No wheezing sounds, feeling of suffocation or constriction in the throat, feeling of oppression or pain in the chest, palpitations, restless sleep. The tongue will have red sides. The pulse is wiry. Lung qi obstructed is due to stagnant liver qi rebelling upward toward the chest. Rebellious liver qi will impair the descending of lung qi, and this will cause breathlessness. This is typically caused by emotional problems, and attacks are brought on by some stressful situation. Feeling of constriction or suffocation in the throat is due to liver qi stagnation and throat obstruction by qi phlegm. That is a very rarefied type of phlegm to the point of being nearly like the qi. Treatment principle: soothe the liver, move qi, restore descending of lung qi, calm the mind, settle the ethereal soul. Points: liver 3, liver 14, spleen 4, pericardium 6, lung 1, ren 17, lung 7, heart 7, stomach 40. We use even method on all the points. Liver 3 and liver 14 soothe the liver and relieve stagnation. Liver 14, in particular, will relieve qi stagnation in the chest. Spleen 4 and pericardium 6, in combination, will open the penetrating vessel or the chongmai. So remember that spleen 4 with PC6. Free the chest and subdue rebellious qi in the chest. Lung 1, ren 17, and lung 7 restore descending of lung qi, free the chest, and relieve fullness. Heart 7 calms the mind, stomach 40 to resolve qi phlegm. Next, we go to liver fire invading the lungs. Attacks of breathlessness precipitated again by emotional stress, feeling of oppression of the chest pain, dream-disturbed sleep, short temper, thirst, bitter taste, dark urine, constipation, headache, red eyes, and face. So the tongue is red, redder and swollen on the sides, yellow coating. Pulse is wiry and rapid. Liver fire invading the lungs includes aspects of the previous pattern that was discussed. Rebellious liver qi invading the chest and obstructing the descending of lung qi. In this case, it is the liver fire that carries the liver qi upward toward the chest. From a 5-element perspective, it corresponds to wood insulting metal. So this is the reverse controlling cycle. Because fire dries up the body fluids, there will be thirst, dark urine, constipation. Fire also affects the mind, causing dream-disturbed sleep. This type of breathlessness is more common and is seen in nervous, highly strung children. Treatment principles: soothe the liver, drain fire, restore descending of lung qi, calm the mind, settle the ethereal soul. Liver 2 drains liver fire. Liver 14 soothes the liver and relieves stagnation of qi in the chest and ribs. Lung 7, Ren 17, and bladder 13 restore the descending of lung qi. Lung 1 relieves fullness and pain in the chest. Bladder 18, Bakshu of the liver, will drain the liver fire. Thank you so much for your attention. We hope to see you in our next presentation. Good afternoon, everyone.